Welcome to Michigan Medicine HomeMed Infusion Pharmacy. This video is a tutorial for using a Joey pump to infuse your tube feeding formula. For Joey pump feeding administration, you will need a Joey pump bag, an IV pole, formula, a 60 milliliter syringe, and room temperature water. After you have gathered your supplies, wash your hands. Ensure that you are sitting upright. If lying in bed, ensure that your head is elevated to at least 30 degrees. Remain elevated during the feeding and 30 to 60 minutes after the feeding. Start with a new Joey pump bag, also known as a feeding set. Shake your formula container to ensure proper consistency. Pour the formula into the bag, secure the lid, and hang the bag so the top of the formula line is 6 inches above the lid of the Joey pump. Turn your pump on using the power button. The first screen is titled Prior Settings across the top of the display. You will use the buttons along the left side of the screen to make your selections. If this is the first time using the Joey pump, choose Clear Settings. If you previously set up your pump, you can choose Keep Settings to return to your settings. For this video, we will clear the settings. Once you get to the display with the hourly rate, which is 0 right now, you have 3 steps to set up your pump feed: loading the feeding set, prime the pump, and adjust feed. The pump will walk you through these 3 steps. Across the top of the display, it says Load a Set, which will be your first step. To open the lid, locate the tab on the left side of the blue lid and pull up gently. To load the set into the pump, grasp the finger tab on the light purple valve and slide the valve into the front channel of the pump. Make sure to push the valve all the way into the channel. Wrap the tubing around the black wheel and pull gently until you can drop the black ring into its slot. Ensure both plastic parts are snug and close the lid. The top of the display screen should now read Set Loaded. Remove the plastic cap from the end of the feeding set. Ensure that the end of your tube does not touch the ground or other soiled surfaces. Now that a set is loaded, you will have the option to prime the pump. Priming allows you to get all of the air out of the line before attaching the feeding set to the feeding tube. This blinking text reminds you to prime the pump before you connect to your feeding tube. With an unused feeding set like we are using here, you have 2 priming options: auto prime and hold to prime feed. First, press and release the auto prime button. The formula will begin to flow through the tubing. The auto prime will not cause the formula to leak from the end of the tube. Instead, the auto prime will complete prior to the formula reaching the end of the tubing. We want all of the air out of the tubing, so now that the auto prime is complete, we will press and hold the Hold to Prime Feed button. Once strips are coming out of the end of the tubing, there is no more air, and the prime is complete. Press the Done button. Your third step to setting up your feeding is to adjust feed. This is where you will enter the hourly feeding rate. The ones, tens, and hundreds place are adjusted individually using the corresponding buttons that are indicated by these arrows. Let's say we want to set the feeding rate to 75 milliliters per hour. Since we want the 7 and the tens place, we will press the coordinating button 7 times. Do the same thing for the ones place to set the number to 5. If you go too far or press the wrong button, continue to press the button for it to reset for each place. When finished, press the Enter button. Let's review the 3 steps to setting up the pump. The display indicates that a feeding set is loaded. We have primed the tubing so there is no air left in the line. Our feeding rate on the right side of the screen is correct. This feed is ready to be connected to your feeding tube. Remember to flush the feeding tube with the amount of water recommended by your clinician prior to connecting the pump tubing. Once you are ready to start your feed, press the Run button. The pump will run at the hourly rate you have programmed until the feeding set is empty. Refer to your feeding schedule provided by your dietitian to know how much formula you can put in your feeding set at one time. If you need to pause your pump, you can press the Hold button. The pump will hold or pause for 10 minutes. If you need to pause longer than 10 minutes, you can power the pump off. If more formula is needed, Leave the tubing in the pump and rinse out the feeding set with water. Use the Hold to Prime Feed priming feature to clean the tubing when it is not connected to the feeding tube. Refill your feeding set according to your feeding schedule, prime the line, and restart the feedings. When the feeding set is complete, disconnect the feeding set from your tube and flush the feeding tube with the amount of water recommended by your clinician. Discard the feeding set after 24 hours of use or according to your clinician's guidance. For information about cleaning the pumps, battery life, and backpack usage, please refer to your Joey pump user manual. If at any time you have any questions or concerns regarding your Joey pump or your home tube feeding, please contact HomeMed or your home care company.